Welcome back. It is nearly summertime, a time to enjoy the outdoors and summer activities. No one wants to be sick or injured and miss out on all that fun. So, of course, today we are going to talk with Hannah Mills here, a nurse practitioner with Cone Health Virtual Care, about common summer ailments or illnesses, how to prevent, treat, and when to go where for a safe and healthy summer. So let's start with poison ivy. This is a big one I've learned since moving here. What are some of those tips to prevent it?
Oh yeah, well, number one is to avoid it. Learn what they look like and try to avoid it. But sometimes we can't. Sometimes we're in the yard, sometimes we're hiking and we get exposed to it. The best way to avoid it would be to wear long sleeves clothing that would protect you, gloves, pants, socks pulled up, things like that. But if for some reason you do come across it, you find that you've been exposed, remove your clothing as soon as possible, wash it in some hot water, and then go wash yourself in the hottest water that you can tolerate so that you can get the oils off of your skin. If you need itch relief, let's say that it did get on your skin and you did get a little bit of the rash and blistering, you can apply the over-the-counter Benadryl creams, hydrocortisone creams, calamine lotion to see if that will help to make sure that it will kind of be more contained.
That's good advice. Okay, so what are some of the symptoms and how can we treat poison ivy from home? I know you mentioned some of those itch treatments. Is there any other ones that you suggest?
So as long as you can contain the rash, those are the most prominent ones that we would use. Sometimes they need to have a little bit stronger steroid creams or oral prednisone, and that's when you would come to see us, especially if you are really bad about scratching and picking, you can get an infection, and sometimes you need to have an antibiotic at that time. We do a lot of virtual care when it comes to poison ivy, so you can do an e-visit or you can hop on and get a video and we can treat you very well with that.
Yeah, I'm one of those people, I can't stop itching things, so I would be there. At what point, you mentioned seeing a doctor. When should they really call and be concerned?
So usually we say if it reaches your eyes or your mouth, you would need to be seen. If it lasts longer than 2 to 3 weeks, it's spreading in multiple areas of your body, or you are the scratcher and you developed a little bit of an infection because you got something in there and we need to have you on an antibiotic at that time.
Yeah, that's good to know because it's always like, when do we do it? Okay, so now we're moving on to bee stings. If you or your child is stung by a bee, wasp, yellow jacket, whatever it may be, what should you do?
Yeah, so it used to be that you would try to remove the stinger, but now we say don't remove the stinger because if you remove it, you could squeeze out more of the venom and that would cause a higher reaction in the skin. So we scrape it off. Like if you're going to apply butter to bread, you just kind of scrape the area off and then you can use cold compresses every 10 to 20 minutes as needed. Tylenol, Benadryl, hydrocortisone cream again, and or Benadryl cream if you want to do that. Keep the area clean and dry and don't itch it because the ultimate thing here is to prevent an infection. Most likely you'll be okay, but we do have people who have allergic reactions to these, and that's when you're going to be looking at the breathing. If you're having shortness of breath, if you're not able to get air in, wheezing, feeling faint, then 911 should probably be initiated at that time.
Yeah, that's good advice there too. How are you going to know that you might be having an allergic reaction? You mentioned, some swelling, hard time breathing. Is there other things? And what should you do?
Right. So when you have the allergic reaction, you usually look at the first sign is going to be breathing. Somebody's throat's going to swell up if they have that anaphylaxis. They usually will have an EpiPen with them. Initiate the EpiPen, don't delay that, then get 911 on board. If you see hives develop, excessive swelling at the location, wheezing, like I said, or the shortness of breath or discoloration in their facial features, then you know that there's something going on and you need to call. Don't go straight to an urgent care. Don't put them in a car if you see these breathing trouble. Make sure you call 911. They can get to you a lot faster and get you the care you need.
That's good advice there. Okay, so we mentioned itching, mosquitoes, the number one itchers, I would say. What are some steps to prevent and decrease that itchiness? And when is it time to be concerned?
So avoid going out at dusk, which is like the time we want to go out because it's so hot outside. And that's the perfect time. But that's the time when they like to come out for their dinner. So wear protective clothing, apply repellents. You have lemongrass, citronella plants, oils. A lot of those can actually be deterrents of them. Stay away from water areas. They love water. So if you have standing pools of water around your house that aren't like a bird bath, try to avoid those, get them cleared out because they love to be around those water areas.
Yeah, I think that's really good advice there too. Okay, so now we're moving on to sunburns. We just had some really nice weather recently. What can we do to help with that?
Number one is prevention. Wear your hat, wear your sunglasses, wear your sunscreen. It's about an ounce to cover yourself, your full body with sunscreen. So always make sure you're using enough. Avoid going outside during the high prime, high index UV ray time frames, 10 a.m. to 3 p.m. If you have to go out there, just make sure that you're being aware of how much you are being exposed to the sun. Reapply every 80 minutes, or if you're sweating profusely, or if you're in the water.
Okay, pools are officially open. I know a lot are excited, and some families might be heading to the lake or beach this summer. So talk about some of that water safety.
Okay, so one, never swim alone. Always monitor children at any time, even if you know that they're expert swimmers, because anything can happen. A lot of people need to wear the U.S. Coast Guard approved life jackets. We don't realize that some of the floaties and other devices are not actually approved devices, and they can actually inhibit children from being able to float on their back, or individuals who do not know how to float. So make sure that it is a U.S. Coast Guard approved life swimming device in an actual body of water. Don't swim by yourself, like we said. Make sure that you're monitoring children. Don't let them play games, or don't play games yourself holding your breath when you go underwater, because you can pass out without realizing it. And then we wouldn't know if you're just holding your breath and you're excellent at it. Stay away from the drains because they can catch you. Avoid alcohol use while you're actually swimming. And most of all, like, learn how to do CPR so that you could possibly offer help to somebody that you know or somebody that you don't know. And if you need to brush up on your skills, Sagewell, Cone Health Sagewell Family Fitness Center on Med Center in Greensboro off of Drawbridge has swim lessons for children and adults. I'm actually looking at putting my daughter in those there.
Yeah, I was gonna say, I know that they happen often, so they're really good classes to take too. Okay, so what are some of the common summer ailments, injuries that people don't think about but should, and what are your tips to prevent them?
So you definitely want to make sure that you're thinking about food poisoning. It's not something that you commonly think about, but think about how many times you go over to somebody's house or you're cooking out and food is left out because we graze, right? A lot of people just graze when you're out at a party or having a good time. So a lot of things like potato salad, meats, and things like that that are left out can actually start to grow bacteria faster because it's hotter outside. Those are things that need to be immediately refrigerated after they're cooked and they're not eaten. Otherwise, you're going to be sick on your stomach. But you can see us on your My Chart for a virtual visit if you need us for that.
You know, with just real quick, what is the rule of thumb if it's been sitting out? Would you say an hour max? Like, what would that time limit be that you need to be like, okay, I'm not eating this?
I would probably do 30 minutes to hour tops. Hour tops.
Yeah, that's good advice. Okay. So something else to be aware of when you're outside, my least favorite animal, which are snakes. What do you do if you're bitten by a snake? Do's, don'ts, and where to go?
Yeah, so snakes are not fun for any of us, and we do have a lot of copperheads around our area, so we all need to be aware of how to handle that situation. If you can immediately move away from the snake's territory, it's going to defend its area and it wants to eat. So stay calm as possible. They always tell you that you don't want to make your heart race anymore because you don't want to pump the venom to other parts of your body. If you can identify the snake, identify the snake. A picture would help. Or if you just happen to know what the snake is, because we need to know that for your care purposes. If you can isolate the area, make sure you immobilize it. If it's a dangerous like walk and it's on the ankle, don't press on it. Remove jewelry if it's on your hands, or shoe if it's on your foot. Get to the nearest medical facility as soon as possible.
Yeah, I think that's great advice too. Okay, so while this isn't just limited to summertime, what if you're bitten by an animal that might have rabies? What should you do?
So luckily, all of our Cone Health urgent care centers can treat and offer rabies exposure follow-up and vaccines. No matter what, wherever you are in the United States, you need to get to a medical care facility quickly.
Yeah, I think that's good advice too. Okay, so then when planning for summer vacation, we might need to be prepared if someone gets sick when we're away from home. What are the available options when we're out of town, and how do you do that? What do you do?
Well, great news. If you're in North Carolina or Virginia, Comb's got you covered. We do all of our My Chart visits through the virtual or the e-visits. We can do that. If you're outside of our area, of course, go to the nearest facility that you can. If you step on a jellyfish, don't wait to be seen. If you need immediate care, go to the closest center. But hopefully, you can use your My Chart and we can help take care of you during the summer.
I think real quick, we've got about 30 seconds. Explain the difference between ER and urgent care. When should you go to which?
So if you have a snap, crackle, pop bone scene, you need to leave home and go to the ED. If you twisted your ankle and it's just a little bruise, but you can still walk on it, you can do an urgent care.
Very easy and simply put.